Welcome to Yashoda Hospitals webinar series. I am Dr. Amar Biradar, Associate Vice President, Yashoda Hospitals. Today is the 5th nursing online quiz, international quiz. On everyone's demand, for the today's international quiz, we have selected the topic on heat stroke, risk factors, and management. I welcome to all participants from different states and different countries. And it is super exciting to see that most of the participants from other countries as well as different states have been participating in this kind of quiz and webinars. They're showing a lot of interest and passion. This is purely to learning nursing fraternity. This kind of quiz and webinar we are conducting purely to outreach as much as possible nursing fraternity, to teach them. The pure vision behind this is our group director, Dr. Pawan Gurupandi sir. His vision is to outreach as much as possible, teach the nursing fraternity, educate them to strengthen the healthcare system, not only in India, across the world. His vision is purely to nothing motive behind it. And it shows, you people also participating and learning a lot of things, exchange of thoughts are happening. So I welcome you all for today's international quiz. I hope everyone is super excited. I introduce you today's host, Ms. Bindu. She is a nursing educator associated. This is long time. She will take us through the today's complete quiz. This quiz consists of 4 rounds. There will be each round will be 3 questions. These are all time bound. Some of the questions 30 seconds, some of them are 60 seconds. She will brief you before starting. These all time bound. It is a rapid fire quiz. There will be how to focus on the time and push the button as early as possible. I wish you all the best. Bindu, please take and start this today's international quiz.
Thank you, sir. Hi, good evening, everyone. I welcome you all for the Nursing Pro Quiz 5th edition. So now, to your knowledge, if you are joined now, here is in a game pen. Game number is 9164169. So even we can see so many members has been joined, around 55 members. So let's start the quiz. So today's quiz is about heat stroke, risk factors, and management. As sir mentioned, we have 4 rounds. In each round, we have 3 questions. So let's start the quiz. Round 1, we are dealing about heat stroke, symptoms, causes, and risk factors. Here is the first question. The first symptom of a heat-related illness is, so heat exhaustion or heat cramps. You can give your answer. I mention again, fastest finger, correct answer will gain the score 5. So we are running out of time. You can give your answers, either heat exhaustion or heat cramps. So 40 seconds more. So 42 members have given the answers. Yes. 33 seconds, 30, 31. So the main symptom, the primary earliest symptom of heat-related illness is heat exhaustion or heat cramps. 19, 17, 16, 14 seconds, 12. Yeah, 55 members has given the answer. For the first question is heat cramps. 18 members has given the correct answer. All the best for the next questions. The scoreboard, we can see Seema is on tops, Sheetal onto the second line. Yeah, the answer is in heat cramps. Heat cramps are generally the earliest symptom of a heat illness. Heat cramps are painful spasm in the abdomen or lungs after prolonged work. They occur when the temperature is high. And the next question, it's true or false, and the time duration is for 30 seconds. Having high blood pressure increases your risk of developing a heat-related illness, whether it's true or false. So if a person is having high blood pressures, is there any chance of developing any heat-related illness? True or false? Yes, 39 members have given the answer. So we are running time. 9, 8, 7, 6. It's true or false? Yes, 54 members has given the answer. 37 were given right answers. Again, the Seema is maintaining a top and Hannah is on to the second level. Yes, it's true. There is a higher risk of developing a heat-related illness if you're following in a salt-restricted diet because of high blood pressures. And without consulting the doctor, you should not take any salt pills. And the last question in the first round, it's a multi-select where you have to select multiple options where you can score double points. So it's a game changer, keep in your mind. Warning signs of heat exhaustion includes, select all that apply. Nausea, vomiting, paleness, muscle cramps, hot skin. So here you're supposed to select the multiple options. So each answer will add up your mark. It's double points. Think and keep. Nausea, vomiting, paleness, muscle cramp, hot skin. What are the warning signs related to heat exhaustion? 33 members, 36 members have given the answers. Yes, 45, 44. 11, 10, 9, 8, 7. Yes, done. We are done with the time. Okay, most of the members were given the answers. So let's see the scoreboard again. Oh, Sima went down to the 5th level and Bhavya is on to the top now. Yeah, they will have a nausea, vomiting, paleness, muscle cramps, and dizziness. The skin will be cool and moist. The pulse rate will be fast and weak, and the breathing will be fast and shallow. If heat exhaustion is left untreated, it may lead to heat stroke. So let's move on to the round 2. The round 2 is about heat exhaustion or heat stroke. So what is the difference between these two things we are going to see in the round 2? So true or false again for 30 seconds. Heat exhaustion and heat stroke mean the same. So it's true or false? Does it mean same or false? Oh yeah, fastest finger. So many members were giving too fast. That's nice. So 59 answers, we received 60. Okay. So 6, 5, 4, 3, 2, 1. Done. Yes, it's false. So if we had seen the last ration very clear, then the answer will be very easy. As we mentioned, heat exhaustion, if it is untreated, then it will land up into heat stroke. So now Vaishu is on the top. So second question, which type of heat related illness have high body temperature? So in which condition that you're going to see the high body temperatures, either in heat exhaustion or heat stroke? So 49, 50. 6, 5, 4, 3, 2, 1. Yes, let's see the scoreboard again. Yeah, Bhavya is on the top, Madhvi onto the second line, Narendra onto the third. Yeah, it's heat stroke. Heat stroke will have a high temperature, whereas heat exhaustion will present with cold, pale, and calm skin. So next is true or false. It's again the double points. So think and keep it correctly for 30 seconds. Is a fast and weak pulse seen in heat stroke? So whether in the heat stroke, are you going to identify the fast and the weak pulse? It's true or false? So 14, 13 seconds, 12 seconds. So 51 has given the answers. Yes. So think whether it's true or false. What you're going to see, observe in the heat stroke patients. Yes, we are done with the time. It's false. Oh, most of the members were given wrong. It's true. Okay, no problem. So Bhavya is maintaining her level again. Narendra has climbed to the second level. So it's false. Heat stroke where we are going to notice the fast and the strong pulse, whereas in the heat exhaustion, we'll notice fast and the weak pulse. We are done with the 2 rounds. The next is round 3. Let's move on to it. And here we are going to see about treatment and management of heat stroke. And in this, the first question. So the sequence of steps to be followed in treating a person with heat stroke includes, we had given the 3 options over here. You need to arrange your options in a sequence. So the first option here is help lower the person's temperature with cool clothes or cold bath. Do not give anything to drink or else move the patient to a cooler place. So you have to arrange it in a sequence. So you have to scramble it and you have to arrange it in a proper order. So what is the order sequence to follow in treating a person with heat stroke? Yes, we are running out of time. Done. Okay. So Bhavya is maintaining the same level. Narendra on to the second. Anna is on to the third place. And the correct answer is first, we have to place the person in a cooler place. Then you have to lower the person's temperature with the cool clothes or else you can provide in a cool bath. And then you should not give anything to drink. True or false again for 30 seconds. So are older people more prone to heat stroke than the younger people? So is it true or false? So older people prone to heat stroke. Is it true or false? Yes, 57 has given the answers. Fine. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Yes, done. Yes, it's true. So let's see who is on the top. Bhavya still maintaining her level and Narendra on to the second and Hannah on the third place. So it's true. So when you notice in the older people, they often have poor circulation and their sweat glands don't work as well as they used to. Older people can't adjust to the sudden temperature changes as fast as the younger people. Okay. So then double points. So game changer again. So think and keep the answer. Which of the following actions should never be taken when giving first aid to a heat stroke patient? So listen very carefully. You should not give an. So give the patient cold coffee to drink slowly. Begin CPR if the patient becomes unconscious. Cool the patient off directly with cold water from a hose. Place ice pack on the patient's neck, armpits, and groin. So what we should not do whenever you're going to give a first aid to any heat stroke patient. So what is your option? Yes. So we should not give anything. So let's see onto the scoreboard. Yes, Hannah onto the top now, Bhavya onto the second place. So Monimala is onto the third place. So what is the reason for it? We should not give anything to drink. As we notice, we may identify the patient with heat stroke may be in an altered level of conscious. And in those patients, if you are giving anything to drink, there may be a chance of aspiration. So we are done with 3 rounds. Now let's move on to the round 4. It's about prevention to avoid heat stroke. So the first question. So it's multi-select, multiple options. You have to select multiple options for this. Following are the measures to prevent heat stroke. You have to select all that apply. So what are the measures to prevent heat stroke? Drink plenty of fluid, protect against sunburns, wear loose-fitting clothing, play under the sun. So what are the measures you will take to prevent the heat stroke? Multiple options, I mentioned again. You have to select the multiple options over here. So 45, 48, 50 members are given the option and we are running out of time. So 0, done. Okay, let's check the scoreboard again. So Hannah is on the top, FB is on the second place, Bhavya on the third place. So Narendra again following on to the 5th place. Yes. So first thing is we have to prefer the loose fitting and lightweight clothing and we have to protect against the sunburn. We have to drink plenty of fluids. And the second question is true or false? 30 seconds again. See, the only way to keep cool when it's hot indoors is to use a fan or air conditioner. Is it true or false? So fan or air conditioner is the only 2 ways to maintain our indoors cool. Is it true or false? Yeah, think what you're going to do. So how you will maintain the coolness at your homes and indoors, what you're going to do. Yes, 63 members have given the answer. 3, 2, 1. 50. Okay, it's false. So let's check onto the scoreboard again. So Hannah is maintaining her place onto the first, Jerry onto the second, and Narendra has came up onto the third place. Yeah, it's false. These are the, yeah, fans and air conditions are they will work best. But even we can maintain the coolness by opening the windows and even other ways as well. So it's a double points again over here. What foods are going to keep you hydrated? So in the summer, what are the foods that you're going to prefer? So mangoes, papaya, watermelon, pineapple. I know most of the people will go ahead with the mangoes, but think to hydrate yourself. So what is the best one that you're going to select to hydrate our body? So 66 has given the answers already. Yes, 9, 8, 7, 6, 5, 4, 2, 1. Done. This is our last question, and the watermelon is our answer. So congratulations to the winners. Join us every day for the webinar. Every Thursday, 3 p.m. we are going to do the webinars. And whosoever has win, you can just take the selfie along with your group and just post it in the social media group. Thank you. So let's check the people who are on podium. And top 3, it's Narendra. Congratulations. Top 2 is Jerry. And top 1 is Hannah. Congratulations to all the winners. Thank you so much. Over to Amar sir. Thank you, sir. Thank you all so much for joining. Over to Amar sir.
So please unmute. Dr. Amar, please unmute yourself.
Sorry, there was some technical glitch. Congratulations for the team who got the first prize, second and third prize. Please log into our page every Thursday 3 p.m. with interesting topics. Thank you, Bindu. You've taken us today's quiz very well. Special thanks to the Shanti Bhattacharya, this VP Nursing. She is the behind the screen for today's quiz to make the questionnaire and make it successful for today's webinar. Thank you to one and all education team. Thank you, this digital. Thank you.